Good day everyone. Today I will discuss pathophysiological conditions caused by unregulated blood pH. Our blood should have a normal pH of 7.35 to 7.45. This means it should not be too acidic or too alkaline. Our lungs and kidneys work together to keep the blood pH normal. So, the lungs control carbon dioxide while the kidneys control bicarbonate. If the lungs or kidneys do not work properly, the blood pH changes. There are 4 types of acid-base disorders. First is the respiratory acidosis. Respiratory acidosis happens when you are not breathing well. Because of this, carbon dioxide stays in the body, making the blood too acidic. What are the causes of respiratory acidosis? First is slow or shallow breathing. Second is lung diseases like COPD or pneumonia. Third is airway blockage. Signs and symptoms of respiratory acidosis. First is difficulty of breathing. The second one is headache. And the third one is feeling sleepy. While the fourth one is confusion. And the last one is weak muscle. So the second is respiratory alkalosis. Respiratory alkalosis happens when you breathe too fast. This removes too much carbon dioxide in making the blood too alkaline. So what are the causes of respiratory alkalosis? So the causes of respiratory alkalosis is first is anxiety or panic attacks. Second is fear. And third is pain. And fourth is hyperventilations. So what are the signs and symptoms of respiratory alkalosis? First is dizziness. Second is tingling in the hands and feet. Third is fast heartbeat. And fourth is confusion. The third one is metabolic acidosis. Metabolic acidosis happens when the body has too much acid or loses too much bicarbonate. So what are the causes of metabolic acidosis? First is diabetes. Second is severe diarrhea. And third is kidney failure. So what are the signs and symptoms of metabolic acidosis? First is deep breathing. Second is nausea. And third is weakness. So the fourth one is metabolic alkalosis. Metabolic alkalosis happens when the body loses too much acid or has too much bicarbonate. So what are the causes of metabolic alkalosis? First is severe vomiting. Second is taking too many antacids. And third is diuretics. So the signs and symptoms of metabolic alkalosis is first muscle cramps. Second is tingling in the fingers. Third is weakness. And fourth is confusion. So in conclusion, blood pH must stay between 7.35 to 7.45. With the lungs regulating carbon dioxide and the kidneys regulating bicarbonate to keep it balanced. When this balance fails, 4 acid-base disorders can occur. The first one is respiratory acidosis. The second one is respiratory alkalosis. The third one is metabolic acidosis. And the fourth one is metabolic alkalosis.